Have you ever brushed off a little tiredness, thinking, I'm just getting older? Or maybe you noticed your hands trembling slightly, your clothes feeling looser, or food just not tasting the same anymore, and you told yourself, it's nothing, it'll pass. But what if I told you that those tiny, everyday changes could be your body's quiet way of warning you? Not shouting, not screaming, but whispering. And the truth is, after 60, your body doesn't always shout anymore. It whispers, softly, gently, hoping you'll listen before it's too late. Think about it. That sudden fatigue you can't explain. That strange loss of appetite you keep ignoring. That moment when you forget where you are, or feel a wave of weakness out of nowhere. You might call it just age, but your doctor might call it something else entirely. You see, the human body is wise. It gives us signs, subtle ones, long before the danger becomes serious. But too often, we miss them. We brush them off, we push through the pain, we keep quiet, because we don't want to seem worried, or weak, or old. Yet those little changes? They could be your body's cry for help. And here's the hard truth. After 60, every small symptom can carry a big meaning. What feels like a simple cough, dizziness, or tiredness could be the start of something your heart, brain, or other vital organs are struggling to tell you. Doctors say the difference between catching these signs early and ignoring them can be the difference between life and loss. That's why this conversation matters so much. Because this video isn't just another health talk, it's a lifeline. It's a wake-up call. Whether you're watching for yourself or someone you love, what you're about to hear could save a life. Today, we're uncovering 6 deadly symptoms you should never ignore after 60. Some of them might surprise you, because they don't always come with pain or drama. They come quietly. And the last one, the 6th symptom, might just change how you think about aging, forever. So, before we dive in, take a moment. Breathe. And if you're ready to learn how to protect yourself, or someone close to your heart, from the silent dangers that often hide behind "it's just age," type "I'm here" in the comments. Let's see how many of us are ready to take control of our health story. And while you're at it, make sure to subscribe to Elderly Wisdom Guide. Because here, we don't just talk about aging. We talk about living, with awareness, strength, and peace. Now, let's begin. Imagine this. You wake up one morning, sunlight gently spilling through the curtains, and before your feet even touch the floor, you already feel exhausted. You think, maybe I didn't sleep well last night. But the next day, it's the same. And the day after that, still the same. You used to enjoy simple things, watering the garden, taking a walk around the block, or even just chatting with friends over tea. But now, even lifting the kettle feels like lifting a weight. You find yourself sitting down more often, taking longer naps, feeling as though your energy has been quietly stolen in your sleep. This kind of deep, unshakable tiredness isn't the usual weariness of aging, it's something else entirely. Doctors call it chronic or unexplained fatigue, and for people over 60, it's one of the most important signs to pay attention to. Here's why. As we age, yes, our energy naturally dips a little. That's normal. But when that tiredness starts showing up suddenly, without warning, without reason, and no amount of rest seems to fix it, it's your body's way of saying, something's wrong. It could be your heart struggling to pump blood efficiently. It could be your thyroid slowing down. It could even be a sign that your red blood cells aren't carrying enough oxygen, something doctors call anemia. And in some cases, that constant exhaustion might be one of the very first signs of hidden cancers, infections, or organ decline. But here's the catch, most people don't see it that way. They say things like, "I'm just not as young as I used to be." Or, "That's just part of getting old." And that belief, that quiet acceptance, is what makes fatigue so dangerous. Because fatigue is often the first alarm bell your body rings when something serious is brewing beneath the surface. Ignoring it is like hearing a smoke alarm and deciding to go back to sleep. So, what should you do if you've been feeling this way? First, don't panic, but don't ignore it either. Take note of how long it lasts. Does it come and go, or is it constant? Does it get worse after meals, or when you stand up? These small details can help your doctor find the real cause. Next, don't try to push through it. Your body isn't trying to hold you back, it's trying to protect you. Sometimes, resting isn't the solution, listening is. And most importantly, talk to your doctor if you've been unusually drained for more than a few days or weeks. You don't need to have all the answers. You just need to bring up the question. Because when it comes to unexplained fatigue, early attention can uncover hidden problems before they become life-threatening. Now, here's something to think about. Fatigue is easy to overlook because it doesn't always come with pain or visible symptoms. It creeps in slowly, quietly, until one day you realize you've lost the energy to live the life you love. That's why noticing it early matters so much. But fatigue isn't the only silent warning your body gives. Sometimes, the danger doesn't come from feeling tired, it comes from something even more subtle. Maybe lately you've noticed your clothes fitting a little differently. Your belt needs a tighter notch, your favorite shirt hangs loosely, or your reflection in the mirror looks thinner than you remember. At first, it feels like a pleasant surprise. You might even smile and think, well, maybe I've finally shed those few extra pounds. But here's something most people don't realize. When you're over 60 and the pounds start dropping without trying, it's not always a reason to celebrate. In fact, it could be your body's way of waving a red flag, quietly telling you that something's not right. Unintentional weight loss, especially when it happens quickly, can be one of the clearest signs that something serious is developing beneath the surface. Doctors often say that losing more than 5% of your body weight within a few months, without any effort, should never be ignored. Why? Because after 60, the body's metabolism changes. It slows down, yes, but it also becomes more vulnerable to imbalances. When weight starts dropping without reason, it can mean that your organs aren't working the way they should. It might be your thyroid becoming overactive, burning energy faster than your body can replace it. It could be a digestive issue, your body struggling to absorb nutrients properly. Sometimes, it's diabetes slowly creeping in, changing the way your body handles sugar and fat. And in more serious cases, it can even be an early sign of certain cancers that quietly drain the body's resources without obvious pain in the beginning. The scary part is, weight loss like this often feels harmless at first. There's no pain, no fever, no clear sign of sickness. It just feels like you're getting lighter. So, people ignore it. They tell themselves, I've been eating less, that must be it, or maybe I've been more active lately. But the truth is, the body doesn't just lose weight for no reason. It always knows why, even when we don't. And here's what makes it tricky. Sometimes, the number on the scale drops slowly, so you don't notice it right away. That's why it's so important to keep track, whether it's weighing yourself once a month, or simply paying attention to how your clothes fit. If you notice your rings slipping off more easily, your watch feeling loose, or your cheeks looking more hollow, that's your cue to take action. Talk to your doctor. You don't have to go in with fear, go in with curiosity. Say, I've been losing weight without trying. I want to make sure everything's okay. That one conversation can uncover what's really happening before it becomes serious. Because here's the truth most people forget. Healthy weight loss happens when you're in control. When your body is losing weight without your permission, it's not a victory, it's a message. And sometimes, that message is even clearer when it's paired with another troubling change. When not only the weight disappears, but your appetite does too. Picture this for a moment. Your mother, the one who used to light up the room with the smell of her Sunday roast, now sits quietly at the table. Her plate is full, the food still warm, but she just stares at it. You nudge her gently, ask, "Aren't you hungry?" She smiles weakly and says, "It just doesn't taste right anymore." And you notice, she's been saying that a lot lately. Maybe it's not your mother, maybe it's you. The foods you used to love don't bring the same joy. You start skipping meals without meaning to. Nothing seems appetizing anymore. It's not that you're full, it's that the desire to eat is quietly fading. Now, it's true that as we grow older, our sense of taste and smell can change. The body produces fewer taste buds, the saliva thickens, and even certain medications can dull the senses. So, food may not taste quite the same as it used to. But when that change goes from different to, "I just don't want to eat," that's when you need to pause and listen closely. Because doctors warn that loss of appetite, especially in older adults, is often more than just a passing phase. It can be a signal that something deeper is happening inside. Sometimes, it's emotional. Depression, grief, or loneliness can make food feel meaningless. Sometimes, it's physical. A lingering infection, liver or kidney issues, or even early signs of organ failure can quietly shut down the body's hunger response. And other times, it's the first clue that your digestive system isn't absorbing nutrients properly, leaving you weaker and more vulnerable by the day. The heartbreaking part is that families often miss this red flag. They think it's just pickiness, or that their loved one is being difficult. You hear phrases like, "She's always been a light eater," or "He's just in one of his moods." But here's the truth. No one suddenly loses interest in eating without a reason. The body is designed to survive. When it stops asking for food, it's because something deeper is wrong. So what should you do if this sounds familiar? Start small, but pay attention. Notice how long it's been happening. Is it just a few days, or has it been weeks since the last real meal? Instead of forcing big portions, offer smaller, nutrient-rich meals, soups, smoothies, oatmeal, fruits that are easy to digest. Keep water close, because dehydration can make appetite loss worse. And if it lasts more than a week, don't ignore it. That's your sign to speak with a doctor. You're not trying to force them to eat, you're trying to understand why they don't want to. That difference can mean everything. Because food isn't just fuel, it's strength, it's healing, it's life itself. And when the body starts rejecting it, it's crying for help in the only way it knows how. But sometimes, the warning signs don't come from what you eat, or don't eat. Sometimes, they show up in how you move, or how suddenly, you can't. John was 72. A retired teacher, strong, independent, still doing his own yard work every Saturday morning. One afternoon, while reaching for a glass of water, he felt his left arm go strangely numb. It tingled for a few seconds, then went heavy, almost useless. He laughed it off, telling his wife, "I must have slept on it wrong." He didn't want to make a fuss. But a few hours later, his speech slurred, and his face drooped on one side. By the time he reached the hospital, the doctor said he had suffered a minor stroke. That story could be anyone's. And that's what makes it so frightening. Because sudden weakness or difficulty moving isn't something that builds up slowly, it strikes fast, and it changes everything. You see, as we age, the body becomes more sensitive to changes in blood flow, oxygen, and nerve function. When something interrupts that, even for a few minutes, the result can be devastating. A sudden feeling of weakness in your arms or legs, loss of coordination, dizziness, or slurred speech can all be signs that blood isn't reaching your brain or heart the way it should. And when that happens, every second matters. It could be a stroke, where a blood clot blocks oxygen from reaching part of your brain. It could be a mini-stroke, something that lasts just a few minutes but still leaves behind quiet damage. It could even be nerve problems caused by diabetes, poor circulation, or muscle decline that's progressing faster than you realize. But here's the problem. Too many people wait it out. They tell themselves, "I'll just rest a bit," or "maybe I moved too fast." They wait for the weakness to fade instead of acting on it. And that delay, those precious lost minutes, can make the difference between full recovery and lifelong disability. Doctors often say, time is brain. That means, for every minute you wait during a stroke, millions of brain cells die. The same goes for heart attacks, every second that blood flow is blocked causes more damage. So, if you ever experience sudden numbness, tingling, loss of strength, or if your face feels heavy on one side, do not ignore it. Even if it goes away after a few minutes, call emergency services immediately. It doesn't matter if it feels small or silly, you can always rule it out later, but you can't undo the damage once it's done. And don't just look for weakness alone. Sometimes it comes with dizziness, blurry vision, confusion, or difficulty speaking. Your words might come out jumbled, or your hand might drop a cup without you realizing why. Those moments matter. They are your body's most urgent SOS. If you're caring for someone older and you notice them suddenly struggle to stand, walk, or lift an arm, don't ask them to sit and rest. Call for help. Strokes don't wait. Hearts don't pause. And neither should you. You might feel scared to overreact, but it's not overreacting, it's protecting life. Fast action saves lives, and it saves independence. Because every second you act could mean the difference between recovery and regret. And when it comes to the body suddenly losing strength, there's something else that often follows, something not as visible, but just as dangerous. It's when the weakness starts, not in the limbs, but in the mind. When confusion, forgetfulness, or sudden mood changes begin to creep in, it's another warning that something deeper might be happening. Have you ever watched someone you love look at you with distant eyes, as if trying to remember who you are? At first, it might seem harmless, a forgotten name, misplaced glasses, repeating the same question twice in one conversation. You tell yourself, it's just part of getting older. But then one day, they can't remember what day it is. They call you by the wrong name. Or they suddenly become irritated, withdrawn, or frightened for no clear reason. Moments like that are heartbreaking. And more often than not, they are trying to tell you something important. See, confusion or sudden memory loss isn't always the slow crawl of dementia. Sometimes, it appears almost overnight, like a switch flipped in the mind. And when that happens, it's often a sign that something deeper, something medical, is going on. For older adults, sudden cognitive changes can stem from things you wouldn't expect, simple causes like dehydration, low blood sugar, or medication side effects. Even a urinary tract infection, something as ordinary as that, can trigger confusion or agitation in seniors. In fact, many hospital visits begin not with pain, but with behavior changes. A normally alert person suddenly can't focus, starts talking strangely, or becomes unusually emotional. Then there are the more serious causes. Mini-strokes, electrolyte imbalances, thyroid issues, or oxygen deprivation from heart or lung disease. When the brain doesn't get what it needs, whether it's blood, oxygen, or nutrients, it begins to send distress signals. And those signals often appear as confusion, forgetfulness, or mood swings. But here's the tragic truth, families often wait. They assume it's just normal aging, that it will pass. Meanwhile, the underlying cause continues to worsen. What could have been treated in a day sometimes becomes a long-term battle. So, here's the rule. If confusion appears suddenly, don't wait it out. Don't brush it off as another senior moment. Seek medical help immediately. Even something as simple as a blood test, hydration, or medication adjustment could make the difference between decline and recovery. And for caregivers, always look beyond the surface. If your loved one seems unusually tired, irritable, or disconnected, ask yourself, is this new? Did it come on suddenly? Because sudden changes in the mind are rarely just about age, they're about health. Now, there's one more sign, perhaps the most critical of them all. The one that too many people dismiss until it's too late. It's the silent warning that your heart is in distress. Imagine this. You're sitting quietly after dinner when you start to feel a tightness in your chest. It's not sharp, not unbearable, just uncomfortable, like someone's sitting on you. You take a few deep breaths and tell yourself, it's just indigestion. But what if it's not? What if it's your heart trying to get your attention before it's too late? For adults over 60, chest pain or shortness of breath is the most dangerous warning sign of all. It could mean a heart attack, heart failure, or a blood clot in the lungs. But here's the tricky part, it doesn't always feel like pain. Sometimes, it feels like pressure, heaviness, or fatigue. For some, it's pain in the jaw, back, or left arm. Others just feel off, dizzy, or winded while doing something as simple as walking to the bathroom. That's what makes it so dangerous, because it hides in plain sight. Many people mistake it for gas, acid reflux, or even anxiety. They take an antacid, sit down, and wait for it to pass. But waiting can be deadly. Every minute a heart attack goes untreated, more heart tissue dies. And once that damage happens, it can't be undone. That's why doctors say, don't wait for the pain to get worse, call for help right away. If you ever feel tightness, pressure, or shortness of breath lasting more than a few minutes, or if the discomfort spreads to your arm, neck, or back, don't try to tough it out. Call emergency services immediately. Even if it turns out to be something mild, it's far better to overreact than to underreact. And if you live alone, keep a phone close at all times. Let neighbors or family know to check in regularly. Many seniors experience what doctors call silent heart attacks, where symptoms are mild or mistaken for fatigue. Those subtle signs are the body's whispers, whispers that become cries if ignored. Your heart has been beating for decades, faithfully, quietly, without rest. It deserves your attention when it finally asks for help. Because when you know the warnings, fatigue, weight loss, appetite changes, sudden weakness, confusion, and chest discomfort, you're not living in fear. You're living in awareness. And awareness is what saves lives. These 6 warning signs may sound frightening, but understanding them is your greatest power. Because health, especially in our later years, isn't about chasing youth. It's about protecting the years we still have. So, if your body, or the body of someone you love, starts sending quiet signals, don't wait. Listen. Act. And remember, your life, your strength, and your clarity are worth every bit of attention they ask for. You know, watching our bodies change, or seeing those changes in someone we love, can be terrifying. It's not easy waking up one day realizing the things that used to feel simple now take effort. Or noticing small shifts in your health and wondering, is this normal, or is something wrong? Those moments can stir fear. They can make you feel uncertain, fragile, or even helpless. But here's the truth, awareness turns fear into strength. These signs we've talked about, they aren't punishments. They're not bad luck. They're your body's way of communicating. They're gentle warnings, soft whispers before the storm, giving you the chance to act before it's too late. Think about it this way. By knowing these symptoms, you're not waiting for tragedy, you're preventing it. You're not living in fear, you're living in awareness. Every piece of knowledge you carry gives you power. The power to call the doctor before things get worse. The power to recognize when your loved one needs help, even when they say they're fine. And most of all, the power to choose life over silence. Because when you catch the signs early, you give yourself, and those you love, more time. More time for laughter. More time for shared meals, long talks, slow walks. More moments that matter. So, if you've noticed any of these symptoms, don't push them aside. Don't tell yourself it's just old age. Make that appointment. Have that conversation. It might feel uncomfortable for a moment, but it could be the most important decision you ever make. And remember, you have far more control than you think. Aging doesn't mean surrendering your health. It means paying attention to it, honoring it, and giving your body the care it's earned over a lifetime. With awareness, love, and timely action, growing older doesn't have to be about fear. It can still be about living, fully, joyfully, and purposefully. Because every breath, every heartbeat, and every sunrise you wake up to is another chance to live wiser, stronger, and more aware than ever before. Let's take a quick moment to recap. Never ignore these 6 deadly symptoms. Sudden or unexplained fatigue. Unintentional weight loss. Loss of appetite or changes in taste. Sudden weakness or numbness. Confusion, memory loss, or sudden mood changes. And chest pain, pressure, or shortness of breath. Each one could be your body's way of asking for help. And when you listen, really listen, you give yourself the best chance at recovery, strength, and peace. Now I want to hear from you. Which of these signs have you noticed in yourself or someone close to you? What changes have made you stop and think, something doesn't feel right? Share your thoughts and experiences in the comments. Because your story might be the one that helps someone else recognize their own warning signs. We learn from one another, and that's what makes this community so powerful. And if this video opened your eyes or touched your heart, give it a thumbs up. It helps more people see this message, and it could even save a life. And don't forget to subscribe to Elderly Wisdom Guide, where every day we share insights to help seniors and families live with awareness, dignity, and strength. Because here, we don't just talk about aging. We talk about living well while aging. So, take care of your heart, your body, and your peace of mind. And remember, aging isn't the end of vitality, it's the beginning of wisdom. Stay safe, stay informed, and keep listening to the messages your body sends. Because life still has so much beauty left to give you. And you deserve to experience every moment of it. This is Elderly Wisdom Guide, reminding you. You are not alone. You are not broken. You are becoming wiser every single day. See you in the next video.